Republican senators continue to focus on the top scientists who helped lead the nation's response to the COVID pandemic. Senators Rand Paul and Ron Johnson released 11 of more than 34,000 text messages from Dr. Anthony Fauci's phone. And as CBS News congressional correspondent Nikole Killion explains, the released messages focus on pregnant women and the COVID vaccine.
Republican Senators Ron Johnson and Rand Paul say that it will take some time to sift through the thousands of text messages that they released from Dr. Anthony Fauci's government phone, but they are highlighting a key exchange involving the potential risks of the COVID-19 vaccine in pregnant women. In fact, they point to one particular message from Dr. Fauci where he discusses reports of fevers or another condition after patients take a second vaccine dose, and that it could, quote, theoretically be associated with miscarriage in the first trimester. He also noted that pregnant women must weigh the potential risks and benefits, although he also noted that no issues have arisen. Now, these internal deliberations with the then Surgeon General and Director of the Centers for Disease Control came just a few months before the CDC ultimately recommended that pregnant women should take the COVID-19 vaccine, citing new data that there was not an increased risk for miscarriage. Now, these messages come after Senator Paul released some of Dr. Fauci's diary entries, and also after his panel recently approved a resolution recommending contempt of Congress against Dr. Fauci. Dr. Fauci's attorney called that contempt vote a crude political stunt and said that Dr. Fauci had committed no crime. This matter is now before the Justice Department.
Nikole, thank you for that. I want to bring in Dr. Peter Chin Hong. He's an infectious disease expert with the University of California, San Francisco. Doctor, great to be with you. Reading those text messages, how do you feel about the public messaging at the time of the pandemic to pregnant women around these vaccines?
Well, I think the public messaging at that time, Liz, was very appropriate. And you and I spoke a lot of times during the pandemic. And I think the main strategy was really one of transparency to engender trust. So we said what we knew, we said what we didn't know. And at that time, we already knew that pregnant women had a disproportionate mortality. They had higher entry or admission to the ICU. They had higher rates of mechanical ventilation. So we knew that COVID was having a big impact on these women.
Now, these text messages were sent in January of 2021. And you're right, you and I spoke probably every single day that year. A lot was changing at that time, not only where we were at, but throughout the entire country and the world with COVID. So as a public-facing health official, how do you balance or determine what information you share with the public?
I think you want to be as transparent as possible. And I think it's important that we say, again, what we have observed, which is, I remember one of the first cases I took care of COVID in the hospital was one of a pregnant woman. And we were concerned not only for the woman, but also for the unborn fetus. We want to be reassuring and only talk about adverse effects when we know for sure that there's evidence. If there's no evidence, I think I probably wouldn't want to say, well, I think that you can have grave harm from this particular intervention unless there was evidence for it. If there's lots of other corollary evidence in non-pregnant people that the vaccine works, I would extrapolate that evidence to a high-risk population.
This week, and it's only Tuesday, there's been a lot of talk about vaccines, not only for COVID, but also for childhood vaccines. And a lot of people are worried. They don't really know who to turn to, who to trust. What's your advice to people, maybe that's a pregnant woman, maybe it's a parent, about vaccines and their safety and efficacy?
First of all, I'll make a statement, which is that there's been no change in vaccine efficacy data, which has been really remarkable in terms of turning back childhood diseases. There's been no change in safety signals that make us worried. So that, I would reassure people, first of all, and it's business as usual. And if people have questions, please talk to their healthcare provider, their pediatrician, their family medicine doctor. But, I think the worst thing that people can do is really be doubtful or worried about vaccines because, again, nothing has changed. And I stand by them. I've really benefited from them. I think it's one of the best interventions we have in the modern world.
Dr. Peter Chin Hong, always great to see you. Thanks so much.
Thanks so much, Liz.